Hello, my name is Nurse AJ. This is my patient. I'm going to let him explain why he came in today. He came into our ER about 5 minutes ago, brought in by a friend, ambulated in with a steady gait.
So I've just been kind of having this increasingly strong headache for the last couple of days. I get them every so often. I haven't been to the doctor, but it's been going on for a long time. Usually get some nausea with it as well, and I usually take like an ibuprofen or Excedrin, but that just hasn't been helping today
Okay.
or the last couple of days.
So we are going to go ahead and perform a comprehensive HEENT assessment to kind of get to the bottom of this. So we'll begin with a assessment of his head and face. I will start by visualizing, so I will visualize his head and his scalp and make sure that there's no lacerations or bumps or bony prominences, and I don't see anything, so I'm going to go ahead and palpate. I'm palpating his hair to make sure that it's not brittle. I'm palpating his scalp for dryness and bumps and deformities, and everything feels okay. And then the rest of his head, which all feels good. No tenderness.
No.
Okay, that's great. So then I'm going to move down and palpate your temporal artery. So I'll just kind of come down and apply a little pressure here. 2+. And then I'm going to come down a little further and reach behind your jaw. And this is to assess your TMJ. So go ahead and open and close your jaw. Great. And then one more time. Okay, perfect. So that all felt good to me, so we can go ahead and move on to the next step of your assessment, which is your eyes. So I like to visually inspect the lids and the lashes, the color. We're looking for any lesions, edema. I'm looking at symmetry, and they're very symmetrical to me. And then also I'm looking for excessive tearing or drainage or anything coming from his eyes, and they look okay. So then I also like to assess his conjunctiva and his sclera, so we're looking for any discoloration, like any jaundice or any cyanosis, and we're looking for any extra drainage, and I don't see anything, so I'm going to go ahead and palpate. We're just going to bring these down. It's nice and pink. And then keep your head straight and kind of look over to the side and back over to this side. I don't see any blood pooling or anything, so that looks good to me. And then I'm also going to check his cornea. So we're checking for clarity, and I will also do a corneal reflex test. So for the reflex test, I have a cotton-tipped applicator with a little wisp at the top. And what I want to see is that when I run this over his eye, we have a blink reflex. So I'll start with his left eye. Okay, perfect. And move to the right eye. Great, okay. So that looks good. So now we can move down, and I will visually assess the anterior chamber. So I'm looking for any bulging iris or blood, which I did not see whenever I had him look around. So then I'm also looking at iris color. He's got green eyes. His pupils look good. They're very symmetrical. And then we can kind of move on to his pupils. So we want to make sure that his pupils are round and equal and reactive to light. So the first thing we'll do is a test. We're going to do the direct and consensual light reflex test. So I'm going to use my pen light here, and it's a very bright light. It would be good to dim the lights a little bit, which I actually already have them dimmed. So for the direct light, I will shine the light into his left eye, and I'm looking for his left pupil to constrict, which it does. That looks great. And then I will come over to his right eye and shine the light in his right eye and watch for his pupil to constrict, which it does, so that looks great. And then I'm going to do the consensual light reflex test. So I'm going to have you look straight ahead again, and just keep your vision straight. I'm going to divide your face with my hand. I'm going to shine my light into his left eye and look for his right pupil to constrict, which it does. That looks great. I'll come over on this other side. I'm going to shine my light into his right eye and look for his left pupil to constrict, which it does. That looks great. So then we're also going to do an accommodation test. So I will have you look straight ahead at my fingers, and we'll start midline, and then we'll move laterally, and then up, back to midline, and then laterally up and down, back to midline. And then keeping your head nice and straight, keep looking at my fingers. I'm going to move in towards your nose and back out. That looks good too. And then I also want to perform a peripheral vision test. So I will have you just continue to look straight ahead. I'm going to move my arms behind your head and kind of wiggle my fingers. And whenever you see them in your peripheral, just stop me, okay?
I see them.
Perfect.
I see them.
Okay.
I see them.
Great. Okay. So that looked good. So then I'm going to go ahead and palpate. So I'm going to palpate his around his eyeball and his orbital bones, and then we are going to also palpate his lacrimal glands and ducts to look for any tenderness or excessive tearing. So I'm just going to kind of push around your eyes. Any pain or tenderness?
No.
Okay. Any pain or tenderness there?
No.
Okay, great. And then also while I'm palpating, I want to palpate your maxillary sinuses and your frontal sinuses. So I'm going to palpate up here on your frontal sinuses. Any tenderness?
No.
Okay. Any tenderness down here?
No.
Excellent. Okay, so with that, I'm going to jump in the room. I'm going to get my ophthalmoscope and check for what we call a red reflex. And we're checking for reflex in any opacity. So what I'll do is I'll have a very bright light, and I'll stand in front of you in about 15 degrees to your left and your right to look into both eyes. And then once I can see that red reflex, I can kind of move in and look past and kind of look down the vasculature and assess your optic disc and your physiologic cup. So I'll be looking for the color, the size, the shape, and then I can also assess your retina and make sure that there's no hemorrhaging and that the color is appropriate, and your macula and your fovea. So I'll look for color, size, make sure there's no degeneration. So I will go ahead and turn off the light here. I'm going to take my ophthalmoscope and turn the setting to 0. And then I'm going to rest my hand on your forehead here. You'll just look straight ahead. And you're going to see this bright light. You just let me know if you need a break, okay? Alright, great. And I see a really good red reflex. I'm going to come in a little bit closer. Awesome. Okay, everything looks really good. Go ahead and take a couple blinks. Okay, I'm going to come in on this other side, and I'll hold right above your eyebrow again and just look straight ahead. It's a really good red reflex. I'm going to come in a little closer. Excellent. Okay, and take a couple of blinks. I'm going to go ahead and turn the light back on. So watch your eyes. Okay, and then last but not least, I'm going to go ahead and pull up my Snellen chart here. So I have a Snellen chart right below the camera here on my computer. And I will go ahead and have you take this card and place it over your left eye. Are you wearing any contacts or do you wear glasses?
I do not.
Okay, excellent.
And I am not.
Okay. So over your left eye, so with your right eye, I will have you start at this 20/20 line. What is that?
DEFPOTEC.
Excellent. And then let's go down one more.
LEFODPCT.
Excellent. And then one more.
FDPLTCE0 or O.
Great. Okay. So and then tell me. Oh, go ahead and place the card over your right eye. So let's start at this line here.
FELOPZD.
And then let's go down one more.
DEFPOTEC.
Perfect. And let's try one more.
LEFODPCT.
Great. Okay, so go ahead and pull the card down. Can you tell me what color this line is?
Green.
And what color this line is?
Red.
Okay, so you have better than 20/20 vision. Alright. So now we can move on to your ears. So I'm going to inspect your external ears. So the position and the alignment, they're very well aligned. I'm going to kind of move them. I want to palpate your tragus and your mastoid for tenderness. So any tenderness?
No.
Okay. Great. Size, shape, symmetry look good to me. I don't see any drainage. I don't see any blood or clear purulent drainage coming from them. Consistency and tenderness. He's denying tenderness, so that's good. So now I can use my otoscope. So I will be using the otoscope with the biggest speculum that I can use just to be able to better assess through your external ear canal into the internal ear. And I'm going to be looking for patency, color, drainage, any lesions. And then I want to be able to look at your tympanic membrane. So with that, I really want a good, shiny, pearl gray, intact membrane in there. And I'm going to look for any redness or perforations as well. So because you are an adult, it does not fit this. Okay. I'm going to go ahead and pull your pinna out and up. If you're a child, I would pull it out and down. And go out and up. I'm looking, and I can see right down in there. We've got a nice pearly gray tympanic membrane. Okay. I'm gonna come in on this other side. And then I'm gonna pull out and up. Look right in. And same, you have a nice patent ear with a good tympanic membrane.
Your phone is not working.
What's that? Oh shoot. Oh no. Okay. So battery's running low, that's bad. Okay, so that looks good. Everything looks normal, so now we can move on to the hearing test. So I'm going to go ahead and have you take your finger and cover your left tragus, and I will whisper a 2-syllable word, and I just need you to tell me what you hear. Baseball.
Baseball.
And then go ahead and cover your right ear.
Apple. Apple.
Perfect, okay. And then we're going to do the Weber test. So I'm going to take this tuning fork, and I'm going to tap it on my hand. And you'll hear the vibration. I'll set it on your forehead and just tell me where you hear it. Do you hear it in one ear, the left ear, the right ear, both ears?
Both ears.
Perfect, okay. And then we're gonna perform the Rhine test. So that's a normal test finding. You wanna hear it in both ears. The Rhine test compares air and bone conduction hearing. So the air conduction hearing should be greater than the bone conduction hearing. So I'm going to go ahead and tap this, and I'll set it behind your ear, and then tell me when you don't hear it anymore, and then I'll put it in front of your ear, and then tell me when you don't hear it anymore. We'll start with your left ear.
I do not hear it anymore. I do not hear it anymore.
Okay.
I do not hear it anymore. I do not hear it anymore.
Okay, great. So that's good. And then we're going to go ahead and check your vestibular apparatus. So with that, I'm going to have you stand and keep your feet close together and close your eyes. Okay, great. So go ahead and take a seat. We just like to check and make sure that you're not having any vertigo and that you can catch yourself. So that was a great Romberg test. So now we can go ahead and move on to your nose, mouth, throat, and neck. So your nose, I'm looking at the external nose for symmetry and any lesions, and it looks good to me. We're going to go ahead and test the patency of each nostril. So go ahead and include your right nostril and blow, sniff, right? And then your left nostril, blow, sniff. Awesome. So those are nice and patent. I'm going to also inspect your nares. I'm going to use a smaller speculum because it's very vascular and I don't want to make you bleed. So go ahead and tilt your chin up. Just go slightly on the inside. Okay. The color is appropriate, nice and pink in there. I don't see any drainage or anything abnormal. So then we can move on to the mouth and throat. So I will use my pen light to inspect the buccal mucosa, teeth, gums, tongue, and palate, and uvula. The mucosa, I just want it to be nice and pink, no lesions, no excess dryness with your teeth and gums. I don't want any bleeding, no decay. So I'm going to look at that first. And everything looks great. And then with your tongue, I'm looking for dryness or cracking or any lesions. So go ahead and stick your tongue out. Looks good too. And then because this particular patient does not like the tongue blade, we're just going to have him stick his tongue out and say, ah. And then look at the uvula, which is not swollen, not red, it looks good. And then his palate is free of lesions as well. So that's great. So then I can go ahead and palpate the inside of his mouth too for any abnormal lumps or bumps. So I've got my gloves on. I'm just going to do a little palpation here. I don't feel any inflammation. Okay, everything feels good. Great. And then we're going to move on to the neck inspection. So I'm visually inspecting and looking for any tracheal deviation or any bumps or anything that looks abnormal, and it looks very symmetrical to me. So I'm going to go ahead and palpate his cervical lymph nodes. So we're going to begin with the preauricular, which means before your ear. So I'm going to use my 3 fingers and just kind of gently massage for it. And then we're going to move on to the postauricular, which is behind the ear, down to the tonsillar, and then down to the submandibular, and the submental, which is kind of right below his chin, and then the anterior cervical, and the posterior cervical. The deep cervical, which is difficult to palpate because it is so deep. So the easiest way is to have your patient turn his head to the right, and then to the left, okay, and then I'm going to palpate for the supraclavicular, which is above the clavicle, and the infraclavicular, which is below. And then we'll move up to the occipital, which is behind. So lymph nodes are about a pea-sized little bump, and we want them to be mobile and non-tender and very soft, so he doesn't have any hard abnormal findings. So then I'm going to go ahead and palpate his carotid pulse. So we don't want to go up too high because that can change his blood pressure very drastically, so I try to go a little bit lower. And you never want to do both sides at the same time. So that feels good. And I don't feel any thrills, so I don't feel that I need to auscultate for a brewery. And then I'm also going to palpate for tracheal deviation, so I just kind of feel down. And then while I'm here, I'm going to assess his thyroid as well. So looking at his thyroid and visually inspecting, there's no swelling. And then whenever I don't feel a goiter or any abnormal indications that I would need to auscultate his thyroid, so that feels good as well. So upon his physical assessment, I feel that now I can take the time to go through some subjective information with him that I will submit in my write-up. Thank you for watching.